Women's hormones can have a profound effect throughout our whole reproductive life, and for some, that effect can be quite devastating. I'm with Professor Isaac Manyonda of the Menopause Clinic in London to talk to us about hormones and the effect that they can have. Professor, what are the main hormones that affect women throughout their reproductive life?
Katie, there are at least 4 well-known hormones. The important ones being DHEA, estrogen, progesterone, and testosterone.
Okay.
Now let me just get DHEA out of the way because it is in fact the precursor or the starting hormone of estrogen and progesterone. And most people out there will not really be aware of its existence. So what most people are aware of are estrogen, progesterone, and for some people, testosterone.
Fantastic. Most women have heard of estrogen and progesterone. What role do these 2 hormones play throughout a woman's reproductive life?
So estrogen is really the hormone that is identified as the hormone that makes a woman feminine. But having said that, actually it is a very important hormone during the menstrual cycle. So it is produced by the ovaries and prepares the womb to receive a fertilized egg and to develop, therefore, a baby inside the womb. Progesterone is almost the opposite in that it is responsible, although it's important also in bodily functions, but it's important for giving the woman the menstrual cycle. So in the first half of the cycle, the estrogen builds up, the lining of the womb builds up, the progesterone levels also rise. But if a woman doesn't fall pregnant, so the levels of progesterone start to fall and she has a period. So these are 2 key hormones, both for the menstrual cycle, for pregnancy purposes, but also for the femininity aspects.
Okay. You mentioned testosterone. That may come as quite a surprise to some women, as they think that possibly that is the male hormone, and they may not actually be aware that women also have testosterone. What role does that play for women?
I'm so glad you asked that question because I believe there's a huge gap in public knowledge, not just public actually, sometimes in the healthcare profession, about testosterone in women. Throughout reproductive life, testosterone is produced by women, not to the same extent as it is produced by men, but it's a very important hormone in terms of women's sense of well-being, building up muscles, good night's sleep, energy levels, libido, you name it. It's a very important hormone. In my book, it's almost as important as estrogen and progesterone. It's just that because we consider it a male hormone, and indeed men produce it in much larger quantities, but it is an essential hormone for women too.
That's really interesting. Thank you, Professor. What happens to these 3 hormones with women at the time of the perimenopause and going into the menopausal transition?
The perimenopause and entering the menopause is really characterized by a decline in the production of all of these hormones. Now, testosterone probably is produced a little bit longer, but ultimately, all of these hormones cease to be produced by the ovaries and other parts of the body, such as the fat, where estrogen may well continue to be produced, but nowhere to the same level as those levels that are attained during the reproductive phase. So after the menopause, the levels of these hormones decline, and in some women, the impact of such a decline is very evident in the symptoms and state of unwellness that they may experience.
Thank you, Professor, for your time. That was really helpful.
Pleasure is mine.